Welcome back to Talk of the Town. Carlye Gilbert is with me, and she is with Hilton Head Regional Healthcare. And it's good to see you again, Carlye. Thank you for being here today.
Thank you for having
So
me.
you are an infection preventionist. I got it right.
You did.
Yeah, I was nervous. I was like, I almost wasn't going to say it because I'm like, I might mess this up. But so really tell us what that is and what your role is in the healthcare.
So an infection prevention is just that. They're someone who's a subject matter expert on preventing infection. So whether it's the flow of the air in an operating room to a terminal cleaning of an isolation room for a patient, how you wash your hands, all different kinds of aspects on how to prevent hospital-acquired infections, and more recent,
you've been very busy
subject matter
recently.
expert on COVID and
Yeah.
how to navigate through a global pandemic here in our local area. So
Right.
so that's been a big part of my last 18,
That was a lot on your
19
plate
months.
for a good bit of time here.
Yes.
And I'm sure it was sort of something like, ooh, I wasn't necessarily expecting this, but here we are.
Definitely not something you decide when you're accepting a new position. That's for sure.
So tell us a little bit about that. How did you get into this, and why were you so interested in this aspect of it?
So I always like to connect the why. I always like to understand why things happen, why we do things. So this was a really great opportunity for me to learn why we do things, why we wash our hands, and try to connect that with our staff and help them to be able to provide the best care and the safest care that they can for our patients and our community.
I really didn't even know it was an actual position or a thing until I met you, and you shared with me about it. So it really is kind of fascinating, and I'm sure you've had to delve a little bit deeper, like you said, over these last 18 months. Tell me a little bit about that learning curve.
So it was a big learning curve, and of course I did it through the pandemic while I was working on a master's degree in nursing. So we really it was a lot, but relying on all of the other subject matter experts that I have in our organizations and really learning from them, research, our external partners like South Carolina DHEC and CDC really helped navigate that path for us.
Well, and obviously you did a fantastic job because you were just recently named a Tenet Hero. So congratulations on that, and tell us what that means.
So that is just the best honor I could imagine for going, helping us to get through this whole pandemic. And I've been with Tenet since 1999. I was before I was even a nurse. So I've grown with them over the years and worked in, 2 different Tenet hospitals, and really it was an amazing honor to be able to support our team and our community that way.
Well, congratulations. I'm sure it was well-deserved. Yeah. So what comes with being a Tenet Hero? Do you get a plaque or something exciting like that?
I had a really beautiful statue. It was a crystal statue.
Wow.
And my picture along with the description of why I'm a Tenet Hero. So embarrassing, but it will be on the wall in our home office down in Dallas. So one day we'll travel to Dallas.
You're going to take a field trip and see that picture on the wall.
Absolutely.
Yeah, that's great. So let's just talk a little bit as we wrap up this morning. As we're going forward, and obviously now you've got a lot of things in place. What do you see as the next steps? We're going to continue to maybe do these air filters and do these things around not just healthcare buildings, but everywhere. So what are you seeing going forward?
So definitely making sure we have good ventilation. Ventilation systems are really important, and washing your hands and making sure we're doing all of those really important infection control practices. Sadly, masks will continue, but for a little while longer, we really need to get vaccinated, because that's truly the key to eliminating this situation we're in.
Well, I think it's definitely opened a lot of eyes to how things spread and how maybe we weren't quite as careful as we should have been in the past. So, well, thank you for all that you do. Thank you for being with us to share about your accomplishment, but also about your journey through the pandemic and what you learned. And we appreciate your information, and it's good to see you.
Thank you for having me.
Yes, and we appreciate you being with us, and we'll see you next time for Talk of the Town.